Public health officials around the globe are currently dealing with the COVID-19 outbreak, known to many as coronavirus, and South Australia is no exception. As the world prepares for the possibility of the situation escalating, this bill that is being today introduced into the House of Assembly, having passed the Legislative Council in rapid order yesterday, seeks to amend the South Australian Public Health Act 2011 to allow the Chief Public Health Officer additional powers to preemptively control the spread of notifiable conditions such as COVID-19 or coronavirus. The proposed amendments will provide the Chief Public Health Officer greater capacity to rapidly respond and contain public health risks related to infectious diseases, while maintaining appropriate protections for individuals such as case reviews and the capacity to appeal to the courts. The proposed amendments include allowing a more timely and rapid process for the Chief Public Health Officer to detain a person engaging in conduct that presents a risk to the public, allowing detention in urgent circumstances where there have not been prior breaches or non-compliance or the service of a direction, expanding the application of controls under the Act to people who could have been exposed to a controlled notifiable condition, previously limited to people who have or have been exposed to a case of that controlled notifiable condition. Where necessary, the amendments would allow verbal orders or directions to require testing, counselling or actions to prevent the spread of infection or detention to be followed with a written notice, and clarify that an order to remain at a specified place could include a hospital or a quarantine facility. Yesterday, in the course of the debate in the other place, the Minister for Health and Wellbeing took on notice a series of questions by the Leader of the Opposition in that House, all relating to potential quarantine facilities. In response to those questions, I am advised that SA Health's planning for a potential outbreak of COVID-19 is ongoing and includes discussion with relevant South Australian government agencies as well as other Australian jurisdictions. The specific details of the plan to be implemented will depend on such factors as the severity and timing of the outbreak. I understand that the member for Ghana has also asked for a comparison with other Australian jurisdictions of new powers for the Chief Public Health Officer with regard to the category of people who could be exposed to a controlled notifiable condition, and I will undertake to come back to the House at a later date with a detailed response to that inquiry in the usual manner we would for a question taken on notice. Sir, I commend the bill to the House.